Why do pregnant women take sulfadoxine pyrimethamine during pregnancy at the ANC premises? As a pregnant woman, have you thought about it? Hello lovely viewers, you're welcome to today's episode on the Guided Midwife channel. My name is Aisha and I'm a registered midwife. On this channel, we talk about everything preconception, pregnancy, labor and postpartum. So please, if you've not subscribed to my YouTube channel, kindly do so by tapping on the subscribe menu and hitting on your notification bar to get an alert anytime I post a video. So on today's episode, I'm going to talk about a prophylactic malaria drug that we prescribe for our pregnant women when they come to the ANC. And this prophylactic malaria drug is called the sulfadoxine pyrimethamine. In short, we call it the SP. So I think no one will be taking malaria drug whilst he or she is not having malaria. But in this case, we call this SP or sulfadoxine pyrimethamine a prophylactic malaria drug because these pregnant women are not having malaria. But we are trying to prevent the occurrence of malaria because if a pregnant woman gets malaria during pregnancy, it's very, very fatal. Because this woman or the baby can get congenital malaria, or the baby is going to have some intrauterine growth restriction or retardation, the baby is going to have low birth weight, premature delivery, fetal loss, or the mother is going to lose the pregnancy, and as well as the mother getting anemia. So having malaria or getting malaria in pregnancy is very, very serious. So that's why we give this sulfadoxine pyrimethamine as a prophylactic drug to prevent the occurrence of malaria during pregnancy. So WHO recommends that every pregnant woman should at least take 2 to 3 doses of SP or sulfadoxine pyrimethamine before birth. So someone may ask, so when is the right time to take this SP or sulfadoxine pyrimethamine? Yeah, it's a very good question though. So this drug is taken during the 16th weeks of pregnancy. That's after quickening. So if I say quickening, it's when the woman starts to feel the fetal movement in the uterus. That's after 4 months during pregnancy. So the funny part is that this drug is not sold at the pharmacy or over the counter shop or whatever. This drug is being given to you at the ANC premises right in front of the midwife. You have to take this drug right in front of the midwife. So at times we inform these pregnant women prior to their next visit that, oh madam, so and so when you are coming to the ANC, come along with your water and eat well before you come. It's not this SP or sulfadoxine pyrimethamine is not given out like the folic acid and fesolate for you to go and take it at home. So SP is being taken on monthly basis. So it's up to your midwife to determine when you are going to take it. Others tend to chew it or swallow it with soft drinks or water. So whatever way that you are going to take it, we are just cool with it. But the most important thing is that we want to prevent the occurrence of malaria because the complications of a pregnant woman getting or having malaria is very, very dangerous. I would want you to take note that not all pregnant women can take the sulfadoxine pyrimethamine. If you are a pregnant woman and you react or you are allergic to sulfur drugs, any sulfur drug, you can't take this SC. Just listen to the name sulfadoxine. It means this drug contains sulfur, meaning you can't take this drug as a pregnant woman. Yeah. So there's a test called a GCSPD test that we let these pregnant women do when they come to the ANC. So when the results comes out to be partial defect or full defect, you can't take this SP or sulfadoxine pyrimethamine because you will react to the drug. So if you have no defect, that's when you can take this SP during pregnancy. And mind you, if you are not pregnant and you are allergic to this sulfur drug or you have this GCSPD defect, you can't take any sulfur drug. So the full meaning of GCSPD is glucose 6-phosphate dehydrogenase deficiency. That's when there is a defect in an enzyme causing the premature destructions or breakdown of red blood cells. So as a pregnant woman, when you undergo that GCSPD test and it comes out as full defects or partial defects, it means you react to sulfur drugs, so you can't take this sulfadoxine pyrimethamine. So it means in any other way you have to prevent yourself from getting malaria. You can also sleep in a treated net. The same applies to those who are also taking the sulfadoxine pyrimethamine drug or the prophylactic malaria drug. The fact that you are taking the SP doesn't mean you won't sleep or you can't sleep in the treated net. In any other way, you also have to prevent yourself from getting malaria. So just recently in Ghana, they are sharing mosquito nets. So if you get one, I have received mine. So if you get one, you have to try and dry it in a cool place for some days and try and fix it in your rooms and sleep under it to prevent malaria. So lovely viewers, I hope each and everyone has gained an insight in this prophylactic malaria drug called the sulfadoxine pyrimethamine. So please, if you know you've not subscribed to this YouTube channel, that's the Guided Midwife channel, kindly do so by tapping on the subscription menu and also tapping on your notification bar to get an alert anytime I post a video. On my next episode, I'm going to talk about tetanus diphtheria. Yeah, in short, we call it the TD. So kindly stay tuned for more educative videos. Thank you. Bye.